So, question 2. So, Mandy, what are the specific mental and emotional health problems women may present with at menopause?
Women will often turn up and say, "Oh, I feel so depressed, I feel anxious, I'm grumpy all the time, my children tell me that they can't stand me anymore, I'm so unpredictable," and they'll also talk about feelings of panic, feeling panicky or quite restless. Menopause is actually an opportune time for women to see their GP, as we know, and it's an opportune time for GPs to talk to women about their mood, about their emotions, about their feelings. There are definite mood changes with hormones, as we know, PMS and postnatally through pregnancy as well, but also with menopause. And the swings of hormones around the perimenopause seem to be the time when there's the most chaos, if you like. What we know though is that a natural menopause doesn't cause depression or anxiety. A surgical or a chemotherapy induced menopause does, probably because of the sudden change in hormones, the significant drop very quickly. But a natural menopause has not been found to account for depression and anxiety. It certainly accounts for mood changes, and there are a couple of factors that will influence whether a woman experiences depression around the time of menopause, and anxiety as well. We know that there are areas of the brain where estrogen and testosterone are responsible for emotional functioning. We know that there is some link with the change in hormones and neurotransmitters and the neuroendocrine function. And we also know from some of the research that if a woman has a mild or a moderate depression and she's given estrogen, then her mood tends to improve. But if a woman has a clinical depression, then estrogen is not likely to be of significant benefit. And there has to be some argument that the estrogen is likely to be improving overall quality of life as well. If you think about the symptoms of menopause and think about the symptoms of both anxiety and depression, there are actually a lot of similarities. So if you think about anxiety, you have sweating, palpitations, often there's behavioural changes like avoiding situations, and a lot of women will say to me, you know, I start to avoid meetings, I start to avoid going into rooms that I know are going to be quite claustrophobic because I'll just get so hot. And then the thoughts start changing along with that, so that the fear responses might increase. But a woman doesn't necessarily progress to a full-blown anxiety. In terms of depression, there are also similar symptoms that we see with menopause and depression, such as a feeling of sadness and that loss of pleasure in doing the activities that you always like. Often the changes to weight, and particularly shape around the time of menopause, with the fat moving up to around the waist, and the distress that can cause. So women often go on diets and change their eating habits. That feeling of restlessness that I mentioned before, which a lot of people with depression will also say that they have, the fatigue, and the fatigue from being awake because a woman has had night sweats and very disturbed sleep. That fog that I also often talk about, that women have that a fog that comes over them because they just don't feel like they can think or concentrate or even remember the name of their best friend, and that's quite distressing, obviously, for a lot of women, and sometimes that can really impact on self-esteem. So women lose a lot of confidence in themselves, that they just can't behave or think the way that they used to, and they lose that sense of self. So one of the most important things that we can do is ask a woman to keep a symptom diary, so that you can sort out what is likely to be menopause and what is likely to be everything else that is going on in her life, or perhaps other factors that are influencing the menopausal experience. just simply asking, how has your mood been lately? To start the conversation can be helpful, and then you can start to get into a bit more detail.